All right. Good morning, everyone. My name is Kim Mabon, and I am the 2021 chair for the Corona Chamber. Today is a great day with some important updates ahead, and we appreciate you taking the time to join us. I will be sharing the agenda with our 2020 chairman of the board, Don Williamson. Don?
Thank you, Kim. Good morning, everyone. Today's our sponsor is a company, a name that's been involved with America for almost 100 years, Howard Johnson's. Howard Johnson's Lodge is located just minutes from Norco College, Ontario Convention Center, and airports. This hotel is conveniently located right off the I-15. Amenities include free Wi-Fi, continental breakfast, an outdoor pool, and free parking. So thank you to Howard Johnson's in Norco today for being our sponsor.
Thank you, Don. The Corona Chamber has partnered with the County of Riverside to provide free disposable masks to businesses. They are available in boxes of 50. Contact the Chamber today to reserve your masks. We also have reusable masks that are for sale. Don?
Our healthcare heroes continue to face huge challenges and fatigue. The Corona Chamber Foundation, in partnership with Frontline Appreciation Group of Corona, has been collecting funds to provide meals of gratitude to these tireless workers. You can see on the screen some photos from the great work they are doing. Donations can be made at givebigcorona.com or by check payable to the Chamber Foundation. No amount is too small. You can also text flag to 71441. Have links sent directly to your phone. Kim?
Thank you, Don. A reminder, please use the chat button to ask any questions. Send your queries to the chamber host and we will verbally ask the questions at the appropriate time. It's my pleasure to introduce the new CEO of Riverside County, Jeff Van Wagenen. Jeff has been a county employee for the last 10 years, most recently as Assistant County Executive Officer. After a competitive nationwide recruitment, we are excited that a local candidate was selected. Please welcome Jeff Van Wagenen.
Mabon, thank you very much for that introduction. And I'd like to thank the Chamber for the invitation to come and speak with all of you today. I am freshly minted in the seat. In fact, the office still has that new car smell, but I am excited about the opportunity. Today's presentation is sort of the 2-minute version because I know you've got other things to talk about and I appreciate you sliding me in. One of the things that I wanted to share with this group is something that was important to our Board of Supervisors and ultimately important to me is, look for additional ways for the county to become a better partner in our communities, in our cities, and with our community stakeholders. One of the things that I presented to the board in terms of a plan is that we do a better job of improving those relationships. Ultimately, what we've learned over the last year is, we've learned a great many things over the last year, one of which is we can't succeed alone, that we need to work together and through partnerships to really accomplish all of our goals. So the view of the county is that we want to be good partners with the chambers, with our businesses. My view of the world is that I serve to not only meet the needs of the Board of Supervisors, but also all of our constituents. That is the 2.5 million people who choose to live here, but also the countless businesses that choose to set up shop here and to make their futures in Riverside County. So the Chamber certainly has my contact information. I will always be available to this group. And I look forward to hearing from you on ways that we can partner for all of our shared success. And so I appreciate, again, thank you for the invitation. And if there's any questions, I'll take them. If not, I imagine I'll be coming back again and sharing a broader picture of what is to come.
Thank you, Jeff, and congratulations on your promotion. Stephanie, do we have any questions for Jeff?
We do not have any questions today.
Okay. I believe, Dawn, you're up.
We are excited to host the return of Master Trainer Paul Webb with his very popular Sales and Marketing Performance Training. Paul offers insights to both business, sales, and customer service and will change the way you do business forever. This program is offered free in partnership with the City of Corona. If you register by next week, by February 17th, you will get that free option. Kim?
Thank you, Don. Next Friday, February 19th is our next Good Morning Corona meeting. Our keynote speaker is Ryan Cora, whose topic, Optics versus Reality, will provide businesses with solutions-oriented guidance. We will also be treated to a business update from Barry E. Knight. This virtual program is just $10 for members. You won't want to miss it. Contact the Chamber today to discuss sponsorship opportunities for the entire year.
Also, sponsorships and tickets are available now for the virtual installation and awards gala on February the 25th. VIP boxes are also available, and they include a wine, glasses, reusable air filter from Advanced Flow Engineering, free breakfasts from Taps, and more. We will install our new board of directors and present awards to some incredible businesses and individuals. Kim will also be sharing her vision for 2021 as our board chairman. Use the bit.ly in the upper right corner of the image in your screen to find out more about sponsorship opportunities or to register. You can also contact one of our chamber staff members to assist you with sponsorship, registration, or to answer any questions. It will be a fun evening, so sign up today. Kim?
Thank you, Don. I'm excited to introduce Alistair Machoka, COO of Corona Regional Medical Center, to provide us with a healthcare update. Sadly, this is Alistair's last week at our local hospital as he moves to another facility within the UHS healthcare system. This is a great opportunity, but we will miss him here in Corona. Please welcome Alistair Machoka.
Morning, everybody. So I'll try and be very brief, and thanks for inviting me. I think I've done a presentation to the chamber before, and maybe one other local group. And when we're discussing in terms of what updates to give, I think there was an interest in trying to understand, what the hospital has been going through as far as COVID is concerned. And I think aside from what you've seen in the news, and I think what you heard from friends and family and perhaps experience yourself, I thought perhaps I should give you a slightly different picture of what we as a hospital has been going through. But before I actually start the presentation, I think I do want to echo Don Williams' quick presentation earlier about the healthcare heroes, and I think FLAG and a number of local businesses and individuals have been extremely supportive of us in terms of bringing food, in terms of just simple prayers. We get a ton of cards from individuals in the community as well as some of the high schools. And I cannot tell you how appreciative our staff is of those gestures, because a lot of times, when you're kind of going through what I call the grind, it's very difficult for you to get the sense that the community is behind you. And I think the food and the events that we've had appreciation. One time we had a whole church that came and prayed for the building, including the patients. All those things do end up boosting morale a little bit for the staff. And for us, again, on behalf of the organization, I'm extremely grateful for that. But what I want to share with you today is kind of like the inside workings of the hospital during Corona, so that you can get an idea of what we've been dealing with. But just a very quick overview. So far, we've tested actually over 13,000 individuals in the facility. This is starting last year, March. Testing was quite a bit of a challenge, but progressively around June, July, we did start getting a little bit faster turnaround times. But we've tested over 13,000 people. And out of the 13,000 individuals that we've tested, we've had over 3,000 patients who've been positive. And while the percentage number may not sound that significant, when I start showing you some of the pictures of the logistical challenges we go through, maybe you'll get an idea of the impact that it's had on a number of our employees and the patients who've come through. November, December, and a little bit of January were perhaps the hardest that we've been hit as a facility. At one point in November, we were running 45 ventilators. That's not just ICU patients, all of them ICU, but there are other ICU patients who are typically on what we call high flow oxygen, which is basically sometimes 40, 50 liters of oxygen through the nose that are borderline intubation level. And multiple times in December, I had to call the county. Dan Bates is our point of contact, to actually ask for vents, because there are times we were down to just one vent and needed to borrow from either our sister facilities or from the county. on a normal day at the hospital here, and by normal, I mean 2019 numbers, we used to run anywhere between 6 to 10 vents, and most of those were a few medical, and a few of them were surgical patients who needed to be on a vent for a couple of days. So when we went up to 45 plus, that was quite eye-opening. Unfortunately, we've lost quite a number of our patients due to the disease, as most of you have seen the numbers. But I think what is also important is to note that we've had a lot of success stories as well. We've had a lot of patients who've come here, stayed in the hospital, been intubated, stayed on a vent sometimes for 4 months, and ended up walking out of the hospital. And that speaks to the heroic work of, the Dr. French's team, the nurses here, the respiratory therapists, and everybody else. So your community hospital is quite appreciative of your prayers, your support, financial, emotional. Bobby has been here constantly trying to figure a way to cheer up the team. And then in December, we did actually get the National Guard, which I think most of you do know, and they were with us for at least 45 days. And they ended up helping us in doing so much, up to and including setting up a tent outside. So I think that's what I'll kind of give as a brief overview, but I do want to give you a picture presentation of what the inner workings of the hospital are like, just to give you a perspective. Let me see if I can share my screen. All right, I'm assuming you guys can see my screen. All right, so, and I'll rush through the pictures relatively fast because I know we don't have that much time. I think majority of the individuals here have probably been to the facility and gone through the ER at a certain point. We opened the ER 3 years ago, 2017. I wasn't here at the time, but it was a nice, shiny, beautiful facility. But because of COVID, this is what we've done. If you walk into the facility now, and this is just an ER, I'll go through the rest of it in a few, there's a ton of plastic. And part of the reason we do this is really to try and create what is called negative air spaces and anti-rooms. Naturally, the hospital, when it was built, we didn't anticipate having a significant number of patients who required to have isolation rooms where you're controlling the air. So we've had to tinker so much with the system to try and creating negative air so that patients who are positive and the pathogens that they produce don't end up flowing back into the common area. So this is our main ER when you come through the ambulance bay. And we've rigged and put all these plastic barriers practically around the entire facility. And like I say, November, December, which is the height of when we had a ton of positive patients, is when the entire facility practically became what you're seeing right now. And the pictures are all the same. You see all the equipment that's cluttered outside, and that part of it is equipment that would otherwise be in patient rooms. You try to keep it outside so that if you have other patients that are not positive, you do have equipment to work with. The challenge with all this plastic, in as much as it does give you some semblance of separation between patients who are positive and everybody else, is that for a nurse or respiratory therapist or housekeeping employee to go into that particular room, they have to don and doff, is the terminology that we use, which is basically putting on a gown, a mask, and all the personal protective equipment. And whereas under normal circumstances, you don't think much about it. You just walk into the patient's rooms, do hand hygiene, and service the patient. This process takes about 3 to 5 minutes at best every single time. So you can imagine when a patient calls, for example, and says they're thirsty, someone has to go through that process and go in. And then by the moment they walk outside, the bell rings again. And the question is, can you please, give me XYZ? And then you have to go back and forth again and do that. So it is extremely taxing. And for that reason, we've had to actually increase the total number of our employees that are on site to help with not just, working with the patients, but also on the cleaning side of it. It becomes logistically quite challenging. So this is the ER, it's all plastic up. We've started taking down a few as the numbers have tapered off. But in December, we ended up putting up hallway beds. Naturally, I did not put any pictures where we have patients. So most of these pictures, I was taking them just for archiving purposes. And as you can see, this is a hallway that otherwise would be just highly trafficked going to the cafeteria that we ended up putting beds. And for about 3 days, we did have patients all lined up on these hallways. And I think for the ones who've come to the hospital, you've probably seen the tent outside. I did give Bobby and a few other individuals a very quick walkthrough through it. We ended up using that tent for about 3 weeks. Thankfully, the numbers have started tapering off again. But nonetheless, it was rather scary times. When you start going to the ICU, similar story again, 45 vents. We have a 22-bed ICU, that's capacity. When you're running 45 vents, that basically means you're starting to encroach spaces that you typically wouldn't use for ICU level care, which means the regular floors and our pre-operative areas, we've all converted them into an ICU because we have to somehow take care of those patients. And this is basically how the ICU looks currently. And again, like I talked about earlier, the challenge with that is every time that RN or that respiratory therapist or that EVS person has to go into a room, you're talking of about a 5 to 10 minute engagement just for one encounter. So for that reason, it's been a relatively interesting, to say the least, time. And I think what breaks my heart the most is for the individuals who are behind those plastic barriers, there's an element of loneliness that only they can candidly explain to you, because there's nothing as isolating as being behind plastic barriers, and every single person that you're engaging with is masked up. You know, not only do they have a mask, we have the face shields and everything else. And I think most of you know that for healing purposes, typically that human interaction is quite critical. But we have a lot of patients who've gone through this facility and every other facility in the country, I would say, that have experienced what personally I think is relatively traumatic emotionally. That's one of our other ICU beds. It's completely negative air. And the story is the same. So I don't want to bore you guys with all these pictures, but if you walk throughout the entire facility up until mid-January, this is how the entire facility looked. This here is a surgery waiting area. We ended up taking over the entire ICU for, the entire pre-operative area, and put our ICU patients there. And the patients who required emergent elective cases, if you will, that you couldn't really postpone at all. What we ended up doing is converting what was a waiting space into a patient care area. And every morning the nurses would huddle up and kind of go through the schedule for the day. We do have patients here, you don't see their faces or anything, but we converted that and made 5 bays out of it. And there's another space again that we've done practically the same thing again. So the impact on these, and I know a lot of times when people talk about hospitals, they talk about the doctors and the nurses, but if you look at that picture, we do have supplies, we do have a computer, and we do have a few other items. So the impact of COVID has gone beyond just the bedside keepers. And there's a lot of other departments that have been significantly impacted because they have to run all these other ancillary spaces and treat them as a clinical area. We've had, supply chain folks who've worked here sometimes 18 hours a day just to try and make sure that the nurse at the bedside has an IV kit whenever they need it, because traditionally they wouldn't have it in there. So we have all these cuts across the facility that they use. Now, what I'm going to show you next is an interesting unintended consequence of COVID. When you run a lot of ventilators tend to use, they use oxygen. And then we have a lot of patients also who've been on what is called high flow oxygen. Essentially, I think most of you know what a nasal cannula is, which is basically the little tube that most people wear when they are short of breath. And that runs about 2 to 3 liters. When we're doing high flow oxygen, we're talking anywhere up to 100 liters of oxygen using a specialized nasal cannula. So when you're running 45 vents and running about 20 of those high flow nasal cannula, it puts quite a bit of strain on your oxygen system. This is the bulk oxygen system. And for a couple months there, our bulk oxygen system started actually freezing up because the demand was so high that the liquid oxygen didn't have sufficient time to, if you will, vaporize. And that's what feeds into the hospital. So what you're seeing here are the coils outside that are completely frozen. And, we ended up at one point having to bring in a truck, an oxygen truck, and connect it to the hospital just to supply the facility with oxygen. That's a picture just showing, what we were dealing with on a day-to-day basis. You do see a water hose here, and I'll explain to you in a second on what that entailed. So literally when it started freezing over, and let me see if I can share a video here real quick, because I think this is good to show. So at one point, this was our bulk oxygen system. So the risk with that, and I think I saw Marshall on the call. He's more of a scientist than I am. He can give you a more detailed explanation on what this entails. Essentially, you risk running liquid oxygen into your pipes, and what we had to do to prevent that is we were paying individuals 24 hours a day to stand outside with a water hose and hose down the coils. So this gentleman here, he's a hero in my perspective, because I think he did the bulk of the work most of the times when I came in. But he would do maybe about 8-hour shifts. And then at night, we had somebody else who would come in. And literally their entire job for that day was to hold a water hose and try to de-ice the coils so that we could supply oxygen to the patients in the facility. You can see him here again, and that's what really he was been doing. We ended up adding these 2 coils sometime in September. There is another coil inside here, but part of it is because the demand was just so significant that we couldn't supplement the facility. But, I'm happy to say we're kind of back to relatively normal times, and by normal I think it's basically saying we're not where we were in December. As I think everybody knows, the numbers are starting to taper off, so the hospital has some semblance of normalcy. We're still running more than 2 ICUs. I think as of last check we had 25 ICU patients, which basically means we have patients in areas that are not traditionally ICU. The vaccination program, we started that sometime in late November, December it was. We vaccinated, I believe, close to 60% of our staff. So I'm quite happy about that. And my hope is that progressively that, the disease will go away and we can go back to normal times. That way, those mothers and those fathers and those relatives that we have that need surgeries that have been postponed since last October can get the care that they need. So from a COVID standpoint, that's what it's been. Again, extremely appreciative of the chamber, of the businesses and some of the individuals on this call who have been extremely supportive of us, whether it's by prayer, food, which by the way, food always goes a long way towards boosting the morale of the staff. So any point that you ever feel like you want to donate any food, yeah, we'll take that. The other item I do want to share, which is more on the better side of the news, we do have a lot of exciting things coming up at Corona. From a business standpoint and from a service standpoint. Every single year, we go through what is our capital budget and try to figure out what services we need to bring to that community. And as we speak right now, we have 2 major projects that I think are going to be extremely beneficial for the organization, for the community. At our Magnolia campus, we are doing construction of an additional 21 skilled nursing beds, and that is slated to complete towards the end of this year. And at that point, I think it will increase our capacity from 40 beds to 61 beds. So that's quite exciting. As well as we just got approval last year to build 2 additional cath labs. We started what is called the PCI program here 2 years ago. And the intent really is to make Corona a chest pain center so that in the event you have a STEMI event or any cardiac event, instead of coming to Corona and getting transferred to Riverside Community or Temecula Valley or Orange County, that will provide all the care for you here. And the beauty about that is tends to be that, if families need to come and visit, it makes it much easier. And the plan is to grow that program so that eventually we can provide a comprehensive cardiac services at Corona. Last year, some of you were here when we introduced our robot. The robot, unfortunately, did not do as many cases as we thought it would last year, naturally because of COVID. But the great thing is, again, we are starting to reopen that slowly, and we just recruited 2 physicians who do bariatric surgery using the robot. So we hope that will kick off sometime in April. And I think it's something worth celebrating that, when all things go back to normal, Corona Regional will be ready to service the community in the areas of need. And that's my spiel. I kind of rushed through it because I know I have a limited time, but there's a ton to share. So I'll leave it up to you guys to ask me any questions that you may have.
Thank you so much, Alistair, for that great update. Every time the hospital speaks, we get a new perspective of the challenges that you face during this pandemic. Stephanie, do we have any questions for Alistair?
Yes, we have a few. The first question, one of the things that you mentioned in your presentation is about the isolation felt by the patients and the staffing there. How do you guys deal with that?
Are you talking about how do we service the patient in that regard? So we started doing Zoom calls for the patients. We've deployed, I think last check was about 40 iPads that we give to patients in the event their family members need to communicate with them. That's working well. I think what we find out for most of the patients who have their own devices, they do direct communication, whether it's video or anything. And then we do have language lines, phones where you can use translators, because we have a ton of patients sometimes who don't speak English as a primary language. And then, worst case scenario, we sometimes actually send our own whether it's the CNAs or the RNs to be at the bedside in the event a patient is not able to hold the device up, and the RN will assist with that. I have to speak of our chaplains who've been extremely, extremely crucial to the process as well. We do have a few volunteer chaplains who come to the hospital, and sometimes they gown up and they'll go sit at the bedside with the patient and kind of share, thoughts and conversations, just to try and alleviate that component. The sensitive component tends to be end of life, which unfortunately we've seen quite a bit. We try as much as we can to accommodate end of life, physical in-person visits, but that's dependent on, where the patient is located and, the circumstances of the end of life. So for the most part, we are able to get at least one family member at the bedside. But then again, there are times that we've not been able to because it's either too chaotic, whether you're running CPR or sometimes it's in an environment where you cannot isolate the family member with the patient by themselves, that their visit ends up becoming probably disruptive. But yeah, so it's a multitude of things that we've been trying to do just to accommodate the patients and the family members.
Thank you. Next question. You mentioned having to staff at higher levels due to the time it takes to, go in and out of patient rooms and whatnot. Is there a shortage of nurses right now? And are there any hiring incentives that Corona Regional is doing to attract more staffing?
Yeah, so that's probably been our biggest challenge. We've given quite a bit of incentives to practically every service, nurses, respiratory, phlebotomists, EVS, dietary aides, and everyone else. We do what is called a bonus, sometimes for picking up an extra shift. So if you've done your 40 hours and you're doing 48 and 60 hours sometimes in a week, we do give them an incentive for that. The biggest shortage has been candidly on the nursing side, and then followed by respiratory and phlebotomists. And that unfortunately has been statewide. I did mention that we had the National Guard here, and part of it is because at one point, our nurses who normally have a ratio where they're supposed to take care of maybe 4 patients in the med-surg unit or 2 patients in ICU, we've had to extend them sometimes beyond the 2 patients to 3 patients, occasionally 4 patients. We do use staffing agencies to recruit additional staff. And the price point candidly is quite exorbitant. And I'll share with you, there's a time we were paying almost $200 to get a nurse from out of state to come and assist. And part of it is a function of supply and demand, where you just don't have any of them. And they're sourced from other states, maybe in the Midwest or in the, Texas and other facilities to come on board. So when COVID started and the numbers were not astronomical, we did staff up where we were trying to get, instead of running 6 housekeepers, we were running maybe 8 to assist with the cleaning processes. But in November and December, the supply of labor was so tight that we were operating candidly quite short. And then using the National Guard and paying the agencies, the staffing agencies, to supplement our staff.
Thank you. Last question today. Do you know if the COVID vaccine is going to become an annual shot, like a flu shot?
That I don't know. I'll be honest with you. That I don't know. My anticipation is that it may end up becoming one, yes, and I think it's a function of how many variants you end up having. And I really don't know exactly what is going to transpire. I think what we try to do is when the guidelines are out and the current ones are out, we try as much as we can to adhere to the guidelines and encourage individuals to take the shot. But as far as it becoming annual, I would be pontificating if I said I know what's going to transpire.
Thank you. That concludes the questions submitted today.
Yeah, thank you very much for the invite again, Bobby. I cannot say enough of your support. Dawn, the history tour was great. I've enjoyed Corona tremendously. We do have a very good hospital willing to support the community. And my hope is that the partnership keeps growing. So thank you very much.
Thank you, Alistair. Appreciate you.
Yes, thank you. And we wish you much success in your next role.
Thank you.
All right. Available now, a new mobile app for Android and Apple. You can post promotions for your own business, find out what's happening, and a whole lot more. Make sure you download it now to start accessing these new features. Don?
Alistair, good luck to you. It's been a pleasure getting to know you. You've done a lot for Corona. You've always been supportive for whatever we do at the Chamber, and I hope to see you again soon.
Yeah, we'll see you around soon.
Back to the announcement. These calls, these business briefings that we have every week are here to help our members. And if it so happens that you're on this call and you're not a member, that's not a problem. You can become a member. Or if you know a neighboring business or have someone who's a business acquaintance that would benefit from belonging to the Corona Chamber of Commerce, please contact Robert Yanez. He's the person at our chamber that can help you out and hook you up with a valuable membership so you can take advantage of all the things that we offer. Meetings like this is just one of the many benefits to being part of an active, thriving organization like this Chamber of Commerce. We serve a regional landscape, so you're not tied in by where you live. As long as you're within the region, you can really benefit. And so anybody can join who's here locally. We have incentives for both joining and referring people to our chamber membership program. We're growing, and the more we grow, the bigger impact we can have. So please contact Robert if you either want to join yourself or if you have someone that should be joining. Kim.
Thank you, Don. At this time, I'd like to introduce our legislative advocate, Jeff Gibson. Jeff keeps a pulse on what's happening in Sacramento and Washington, D.C., allowing us to act timely on projects and initiatives that help make a difference in shaping our community. His knowledge of complex political issues and great relationships ensure the Corona Chamber has all the tools to be effective on behalf of the business community. Please help me welcome Jeff Gibson to elaborate and bring us up to speed.
Good morning, everybody. We have a couple of significant updates. The most significant was a couple minutes ago, the governor's Secretary of Labor and Workforce, one of the chief enforcers of keeping your businesses locked down, was just appointed by the new administration in Washington, D.C. to be the Deputy Secretary of Labor and bring those policies on a national basis. So we will be seeing a lot more regulation dealing with COVID-19 in the future, if that's any indication. So with that lovely note, let's jump right into the update and go into what we've spent a significant amount of time on this week, last week, and the week before, which is a statewide effort that started in the state legislature, but they couldn't get it passed. And so cities on an individual basis, counties on an individual basis have been considering mandating, and it's a permanent mandate, it is not a temporary mandate, a $5 wage increase across the board to all workers of most businesses. Now it's being billed as restaurants, retail, and groceries, but the concern becomes that it deals with businesses as they reopen, and it's a $5 across the board wage increase under the term hazard pay. So as much as happens, and we've seen this before in Sacramento and Washington, D.C., that when something happens on a temporary basis, so say just think of any government regulation that was supposed to last 2 weeks and now has lasted almost a year. That when you do not have a solid sunset date on a piece of legislation, that it lasts forever. For instance, each and every month, you as a mobile phone owner pay $1 to the federal government to finance the Spanish-American War. That was put into place in 1896 as a luxury tax on telephones, and is still with us today. So hopefully at some point we can pay off whatever debt we still have from the Spanish-American War and save you $1 a month. But what we are facing here is there are approximately 10 to 12 local agencies. Oakland, Los Angeles is considering it. Long Beach has passed probably the most sweeping act. San Diego is considering it. Several different counties have it on their agendas for consideration. And what we have joined with the Cal Chamber and a number of businesses to let our local governments know, and let the other local governments across the state understand that the last thing that you need, if you have been struggling for 10 months under unprecedented government intrusion into business, that, and not to argue the policy, but the fact is we've never had a government agency response like this, that we are stressed beyond the max, beyond, and that mandating a $5 an hour wage increase across the board with no solid end date is not the thing to do, is not going to create more jobs. The economy has been shedding jobs. It shed jobs in January. It looks like we're heading back into a recession, unfortunately. So we're at a very difficult spot. If you would like to join us in that, let us know either on this call or by email, or however you'd like to communicate with us, and we will include you as our name is going out to these government agencies that are considering this, because this is a very real thing. It's not just specific to one area or one policy group. And it's unfortunate that totally and completely understand everybody would like a wage increase. That is up to you as a business owner to decide what you can afford and when, as opposed to having it mandated across the board. So that's definitely something. Every week we have a question of how can you help? That is definitely something that you can help on, and it is pervasive. It is being pushed on every local government, no matter where you are in the state. So there is definitely a campaign to basically create an end run around what is already the country's highest minimum wage law. If you remember, January 1st, the governor declared that there was not a state of emergency for any purpose, which he had to do in writing in order to allow the minimum wage to go up an extra $1. So several years ago, we had at midnight, the state legislature passed SB 3. We worked very hard to defeat that. That was a minimum wage increase of what was billed as $1. Unfortunately, within the bill, which we knew, and we lobbied very hard to either get out of the bill or defeat the bill, was a provision that each and every year in perpetuity, up to $20 an hour minimum wage, unless the governor made a specific finding that there was an economic situation that required that businesses be relieved from giving an extra $1 an hour. So in January 1st of this year, as the state was in its 10th month of recessionary economic activity, and obviously in the lockdowns and everything else that we've gone through, Governor Newsom decided that this was not a government, that this was not, did not qualify as an economic emergency, and enforced another dollar. So the minimum wage, I believe, is $12, might be $13 an hour now. So with that, so that's where we are on state policy, and that's how you can help. I think Bobby just put in the chat, the email that you can respond to let us know how you would like to deal with this. Coming up last week and then into this week as he begins his term, the new transportation secretary, thank you, Mike, it's now $14 an hour, I apologize. So $14 an hour minimum wage in California, considering that it likely will become $15 next year on January 1st, and then again going up to 20 over the next 6 years. Unless there's a specific finding again by the sitting governor, whoever that may be. And we have a transportation funding update for you. As you know, we are very active in Washington, D.C. and Sacramento to gain our dollars back that we pay to those great agencies in the form of road improvements, specifically in the 91, the 15, but in other areas as well. As you know, if you were on this call, or you might not know, the Cajalco interchange, which was the largest recent project, but not by no means the only project that you've gone through, was funded using private dollars that the city negotiated as part of the Bedford Development Agreement, and was awarded special status by the state Senate and the state Assembly. So the city is very adept at understanding, has a long history, as does the chamber, in getting transportation funding. So this is something that we follow very, very closely, because the better our roads are, the closer you are to a larger number of customers. When the 91 was approved, we did a calculation that technically moved Corona 20 minutes closer to the city of Los Angeles and Orange County. So that you were much closer practically, because that was the projected cut in traffic at the time. So the federal government controls a huge amount of the road money that we pay, both at the pump and throughout the federal tax process. And so the new transportation secretary is the former mayor of South Bend, former presidential candidate, Pete Buttigieg. So, and in his inaugural statements, he talked about a couple different things that we really need to review here, so that you can understand how we are going to have to work during his term on this. So the first is, he announced in coordination with the administration's goal of having a net zero carbon emission economy by 2040, that the transportation department, the federal Department of Transportation, was going to be working to eliminate the sale of gasoline powered vehicles by 2035, which is the California code for the entire country. So in California, gasoline powered vehicles are going to be banned for sale after 2035, new vehicles after 2035, and new trucks and any mobile source at all after 2045. And so the new transportation secretary for the United States of America has decided that is part of his top line agenda goals. The second is pursuing federal regulation that, because Congress has already turned it down, but pursuing federal regulation from the Department of Transportation, that cities like Corona dedicate flex lanes that are paid for with gas tax money, and for bicycles, pedestrians, and all manner of electric vehicles that would not qualify as cars. What these programs generally mean, if you're in a larger city, sometimes you'll be driving and see a green lane. Those are the flex use lanes. And previously, those have not given a city or a local government any sort of additional advantage in seeking state or federal funding, which again is our dollars. So we're asking for our dollars back. That's really what we do here is we work to make the regulations make as much sense as possible, make sure that the taxes that you pay go for the services that are promised. And when we are in competition for road money, et cetera, that we do the very best that we can to bring that back. And so that's why we're paying attention here today. So what he's proposing is to force cities to adopt flex lane programs so that they could then qualify for federal road money. If they don't provide federal or flex lanes, then you're in a position where you don't qualify for federal funds. So that's going to be something that we're monitoring very closely and working with the city to make sure that we keep those lanes open, because obviously cutting out 50% of our lanes for other uses that can be used for the sidewalk are something that is going to be very difficult for local businesses. So, and then finally, he backed an effort to not only increase the gas tax between now and 2035, obviously, but to actually fit each vehicle with a transponder, and then have a federal tax based on the vehicle miles traveled for each individual. So you would pay at the pump, and then you would also pay for each mile that you would use. So these have been looked at by Congress in the past. Each time on a bipartisan basis, they have been turned down. So we are going to be tracking the regulatory background on these to make sure that they don't take effect and damage your ability to operate, because each and every study on taxing by vehicle miles traveled talks about the waterfall of job losses and business losses, because you're looking at a 15 to 20% increase in the cost of moving anything, either commute wise or goods wise. So it's definitely something that we are tracking very closely. And with that, I'm happy to answer any questions you have.
Thank you so much for bringing this information to our group each and every week. Stephanie, do we have any questions?
Yes. So Jeff, if the increase for hazard pay goes into place, will the liability now be taken on by those municipalities, counties, etc.?
No, it goes directly to the business owner. So if you're paying the state minimum wage of $14 an hour, and the city or county that you're operating in, and you have contracts in Long Beach, for instance, you now have to pay $19 an hour. And if you're paying a supervisor $19 an hour, you would have to pay that supervisor $24 an hour. So no, there's no liability for the cities do not reimburse at all. No, the government agencies, no, there's no reimbursement or additional cost to them or risk to them at all. It is a straight unfunded mandate on the businesses.
Will there be court challenges to these Department of Transportation proposals?
You'd have to take there may very well be. We've seen recently. I would refer you to what I tell clients all the time. Unfortunately, we have a court of laws, not a court of justice, and courts are really not the best avenue for challenging this. Unfortunately, the Congress and the legislatures are really the best way to prevent the policy from going into effect. It is very, very difficult once an administration decides that they want to see a regulation take effect to have it removed either through the courts or otherwise, because really what you're doing is you are questioning the ability of the administration in this case to enact laws, and courts are very they're not super reliable on that. there have been some successes, but for every success, there's, you know, there 2/3 of the cases go against you. So, but we're going to be monitoring both the legislative side of this, the administrative side of this, and the judicial side of this. So.
Thank you, Jeff. Those were all the questions that were submitted today, but wow, was that a lot of a lot of stuff to unpack. So thank you for monitoring that on behalf of our business community.
You're welcome.
Yes, thank you, Jeff.
Thank you, guys.
Don?
Don, you're muted.
Once again, we would like to thank the sponsor of today's call, Howard Johnson's of Norco. You can learn more about the availability of their facilities and at their location. Howard Johnson's by Wyndham website. You can look it up there, or through the Corona Chamber of Commerce. Again, thank you to Howard Johnson's.
If you would like to sponsor a future business briefing, please contact Bobby at the Chamber. Register now to join us next Wednesday for more advocacy news. We will also hear from Riverside County Economic Development. Thank you everyone for attending. Today's meeting is now adjourned.